Alright, so we talked about how Mike needed x-rays, CAT scans, MRIs, and bone scans. So we're going to look at what each of these are, how they work, and the differences. And again, you can look at the PowerPoint on the resources the next page. You can watch this video again, but you're going to have to take notes on this. The activity is just taking notes on these um, different technologies. So here's a vocab, but I'm not going to spend any time on this because we're going to go right through them. So, an X-ray. Alright, so an X-ray is non-invasive. Um, they use electromagnetic radiation, so the dense tissues are picked up. So generally, bone is picked up the best in X-rays. You can use a special dye to highlight areas like, especially the digestive system. You can drink something and it will highlight that area. And structures containing air might appear black. So generally, we don't see the muscles and the fat in the fluid very well. It's only a two-dimensional image, so you have to take a bunch of different X-rays at different angles if you want to see more things. It can increase the risk of developing cancer because of the radiation you're using. So this is what a machine looks like. You guys have probably all seen an X-ray machine before. So the advantage is it's painless, very quick. It only takes like a second, and it's inexpensive. The problem is the small amount of radiation, which, unless you're getting X-rays all the time, shouldn't be a big deal. And also the contrast materials, so the dyes that you're taking. Plus, it's only a 2D image that should probably be here. You can only really look at dense structures. That should also probably be here. Those are some disadvantages to X-rays. Alright, CT scan. So generally these are if there's, depending on what you're looking at, and also if you have a more serious injury. Again, this is not invasive. It's pretty much a bunch of different x-rays taken from many different angles, and then it produces a cross-sectional image of the bones or soft tissues in your body. So here's your skull, and it's been taken at various different sections, slightly different areas. You see how the eyes are positioned differently, so you can see inside and look at the different tissues. So it generally, you can look at the chest, abdomen, pelvis, spine, obviously your skull. So this looks like it's taken from below, and this is taken from above. And again, it uses the same radiation, so that could be a problem. Alright, also people can get claustrophobic because you're putting them in this little donut tube here. And it just slowly takes the x-rays around the different part of the body that you're taking it on. So again, you would have to use some kind of contrast materials most of the time. This is nice. You can see soft tissue in this one. And you can also see it all along with the bone. You can see it as all together. Again, it's painless, non-invasive, just like an x-ray. And if there's any medical device, it can be implanted, it can be taken just the same as an x-ray. Alright, so now on to the MRI. So MRI gives you similar views as a CT scan, but they use powerful magnets, and you can see the better soft tissues rather than the bones and the teeth. So if you really want a good picture of the soft tissues, you're going to look at the MRI. So we have this, so you can see the bones. Let's see how well you can see the bones, but you can also see the dense muscle tissue here around the knee and the ligaments and the joints because of the MRI. Here, the brain, you can see a lot better, and look at the detail you get of the face, nasal cavity, and the muscles in the neck a lot better than you did in that CT scan. It's very safe. The only problem is you can't have metal, because obviously magnets pull metal. So you wouldn't be able to use if anybody has any kind of metal implant of any kind, you wouldn't be able to use an MRI on them. Again, you go into this donut, so you could be claustrophobic and cause problems. So that's kind of a disadvantage. So if you have any implants, you can't use an MRI. Again, you could have allergic reaction and contrast, but that's pretty much all of them. And then the confined space, because you're pretty much completely in a tube, could be claustrophobic. But the good things are you can see the soft tissue, so if you really need to see that high view of soft tissue, it gives you a good image. Alright, now the last one is a bone scan. So we're going to use nuclear imaging, meaning you're going to put a radioactive dye into the bone and look at the bones. So here's a sample image. And it's used to examine the skeleton, like the whole skeleton, so you can look for abnormalities in these. And again, you use these radionuclides, these tracers, and that's what's picking up the bone all over. And they look for abnormal bone metabolism, so you're looking for tumors, basically, or abnormal growth or anything like that. So you can get the whole skeleton at one time. You can't determine the cause or anything. You can just see that there's more metabolism, and those tracers have a small amount of radiation, so that's also a disadvantage. So your goals in these are just, again, to take notes on these and make sure you understand the differences and when you would use these different types of radiology technology. And again, this is one of the main things you use to determine cancer because you're looking for tumors. So either come back to this video or you can go through the PowerPoint as you take your notes.